Grade 3 teacher Kristi Chipeniuk has been living with terrible tastes and smells for nearly a year. There are very few foods she can tolerate.
Lettuce and tomatoes are still my staples. Most of the other things either taste like dirt or just taste like they've already gone bad.
To Kristi, most meat tastes rotten. Coffee smells like gas. Her disorder is called Parosmia. It showed up shortly after she had COVID-19. When Kristi shared her story with Global News last May, she hoped relief would come soon. It didn't. Instead, she's learning to cope and making videos about it.
I don't add banana anymore because they taste like chemicals, unfortunately.
Quebec researcher Johannes Fresnelli says smell and taste issues still affect many infected with COVID.
We know now, and it depends a little bit on the variant that we're looking at, but approximately 60% of infected people lose their sense of smell in the acute phase.
In his study of healthcare workers, half who lost their smell said it was not back to normal a year later.
The odors that they smell, they don't smell as they're supposed to smell. So instead of vanilla, they would smell, let's say, burnt rubber or something like that.
Edmonton's long COVID clinic continues to see patients with parosmia and anosmia, or no smell. The most common treatment is olfactory training.
Several times a day, they just open up the vial and they practice smelling, kind of like resetting the sensors and the part of the brain that perceives smell.
Kristi says the only thing that's helped her so far is connecting with others with parosmia.
They tell me like, oh my gosh, I thought I was the only one. And it does feel like that. And it can be very isolating.
Online support groups share tips and recipes. Bland cuisine Kristi hopes she won't have to eat for much longer.
I cannot wait. I have a whole list of things I'll be having that day. Let me tell you.
Su-Ling Goh, Global News.